Welcome to the RN Mentor Podcast. I'm Dr. Ali Tayeb, nurse, educator, advocate, and United States Navy veteran. This show is about real conversations with nurses moving the profession forward. We discuss leadership, practice, policy, research, and more. What matters and why it matters. I'm glad you're here, so let's get started. Hello and welcome to another episode of the RN Mentor Podcast. I am extremely excited today to be joined by Dr. Rosa Gonzalez-Guarda. Gonzalez-Guarda is an associate professor at Duke University's School of Nursing. Her research addresses the intersection of violence, substance abuse, HIV, and mental health through developing, testing, and scaling multi-level interventions to address common social and structural drivers of these conditions. She uses a syndemic orientation, mixed methods, and community-engaged strategies to influence practice and policy changes to promote health, equity, and social justice for Latinos, other racial and ethnic minoritized groups, and communities affected by trauma. She is currently the principal investigator of two research studies, which is developing a community academic research partnership to address gun violence prevention among Latino youth, and an NIH-funded study conducting a community randomized trial of a community healthcare worker intervention addressing stress, resilience, and syndemic outcomes among Latino immigrant families. Dr. Gonzalez-Guarda has had a long-standing commitment to diversifying the nursing workforce and improving the capacity of healthcare providers and scientists to address health equity. She is currently co-leading an NINR-funded T32 entitled Nurse Leads, Training in Nurse-Led Models of Care Addressing the Social Determinants of Health, which includes a strong partnership with minority-serving institutions. She also leads various local and national initiatives addressing violence, mental health, and health equity, including serving on the board of directors for El Futuro, the Future, a local community-based mental health organization serving Latino and immigrant communities, and co-leading the health equity core for the National Institute of Health Collaboratory, Pragmatic clinical trials. Welcome to the show, Dr. Gonzalez-Guarda.
Thank you, Ali. I'm a big fan of your podcast and feel honored to have an opportunity to talk to you today.
Oh, thank you. I appreciate that. We have known each other for a few years. Sometimes we run into each other at conferences. Your bio is amazing. And when I read it, I'm like, oh my God, what am I doing with my life? But it's quite impressive. And I've heard you speak a few times and always impressed by the knowledge that you share, because there's always nuggets of knowledge gold nuggets of knowledge that you pick up on those. So I appreciate that. So let's get started with this recording and say, how did you get started in the world of nursing?
That's a story that started for me when I was in high school. I'll try to be brief because I could spend a lot of time on it. But when I was in high school, I had this wonderful opportunity to do mission work in the Dominican Republic. And when I was the summer year of my sophomore year in high school, I had the chance to do this. And I spent the summer on a sugarcane field where we were working with Haitian migrant workers that were coming to the Dominican Republic to do work. And in that, had the opportunity to work with these nuns that were from Brazil. And the nuns were also nurses.
Wow.
And what they did, their work was focused on improving the living conditions of the migrant workers, really focusing on housing, making sure that they were getting paid fairly, because at that time they were getting paid money that they could only use on the plantation.
Oh.
And so I saw how their advocacy and their work to improve their living conditions, their wages, their access to healthy food had a direct impact on the health of the migrant workers and their families that lived with them. And so I didn't have the terminology, then to talk about the social determinants of health, but it was really that intersection of the social aspect and the health and the advocacy of the nurses that were public health nurses that inspired me to go into nursing. So while they tried to recruit me to become a nun, that didn't work out, but they did. They did inspire me to pursue nursing, and I went into nursing really wanting to do public health nursing. And so that's how my career started. When I was in college, when I was studying to be a nurse, I started to get more exposure to Latino communities in the United States outside of my hometown of Miami. So
Mm,
I grew up in Miami where I was actually, as a Cuban American, part of a majority group, right? And so we had a lot of access to resources that don't exist in more recent immigrant communities
mhm,
where there's less political representation or representation of healthcare providers that are from the same background. And so when I was in Washington, D.C., working as a nurse, I found myself having to do a lot of advocacy for the Latino community, and really realized the inequities that existed for Latino immigrants in the United States. And that shifted my focus from wanting to do more global work around injustices I saw around social and societal factors and health to really focusing more in our own backyard with the
mm.
Latino community here in the United States.
Yeah, yeah, that's amazing. Um, it's interesting how different influences throughout our lives kind of lead us down a pathway, whether we realize it or not, or how purposeful it is. It's really interesting. Um, I, you know, and your story, I mean, the fact that it is very similar to uh, so many other stories that you have this intersection of individuals in our lives. And for the purpose of like this podcast, like really focusing a little bit on mentorship of how the individuals, even though the intent may not have been to mentor you or guide you in any way, it actually led to an entire career that's influencing so many other people. Uh, so I'm always whenever I think about like people, I gave a talk yesterday, and that's one of the things I mentioned is like when you think about all the people that influence you to the point where you and I are having this conversation, it's in the hundreds of people that influence your life in various ways. So it's always amazing how that happens.
It is remarkable when
Yeah,
you see, someone might open a door, you walk through it, and then there's other doors that are opened by other
yeah,
people, and you start, with their help, you're carving your unique journey and life path, right, in your
yeah,
career.
yeah. Where did you go to your nursing program at?
So, I have another wild story of another person opening a door, a mentor. I went to do my BSN at Georgetown.
Mm,
And I went to Georgetown at that time because back in the day, there was not many programs that had a public health or international health focus. And that was one of the few places that did. They launched an international health certificate the year that I went, my freshman year in
oh
the
wow.
BSN program. And I mentioned that I went into nursing to do public health nursing. So I enjoyed all my courses. But when I got to the public health nursing class, I was just completely reaffirmed that this is exactly where I needed to be. And ironically, my the faculty that was teaching that class is actually our current dean now that was recently put into his position as our permanent dean, which is Michael Ralph.
Amazing.
He had just graduated from Hopkins with his PhD, and he was teaching his first class, and I was, one of his first students in this class, and I had never met another public health nurse, so it was so amazing to meet him because he has that background. And because of him, I had an opportunity to do my practicum in the community, which was unheard of at the time. People would
Mm,
traditionally go into the hospital and do their practicum or internship in an acute care setting, but
yeah.
he really advocated for me to be able to do my practicum in an HIV clinic.
Wow.
And he also encouraged me to apply to Hopkins Masters of it was a dual degree program in nursing and public health. So I got a master's in public health nursing, and at the same time got a master's in public health.
Wow.
And so it was from him, really planting that seed and telling me about that program that I pursued that approach.
Yeah. That's incredible. Um, So you bring up an interesting point because the public health component, not every state has a public health requirement.
Mm-hmm.
California has it for the bachelor's degree program. So if
Mm-hmm.
there's a bachelor's degree in California, there has to be a public health course and a clinical associated with it,
Mm-hmm.
which for a lot of schools is a kind of a pain in the behind, just because finding enough placements for students in a public health setting is challenging. But I'm glad they had that. Now, my question for you is from because nursing really is a public health. Uh, I mean that's what we just like if you look at it from an NCLEX perspective, there's no public health in there. When
Mm-hmm.
you look at it from the perspective of the work, we have changed the work so much that it's hospital-based work. That's sort of like people don't even necessarily even think about public health being a nursing thing, right?
Right.
So from
Mm-hmm.
your perspective, I mean, you had insight very early on, and that's fantastic. I didn't have that kind of insight, even though most of the work that I do now is public health facing, right? But how does I'm trying to formulate this question in my brain. How does nursing really shift gears for not necessarily people like me who've been around for a while, but shift gears so we are doing a better job in introducing public health nursing to the people that are coming into nursing? Like, how do we do that?
That's a really good question. I don't think I have the answer to that. I have some ideas. So
Ideas are good. Ideas are good.
this would be
There's,
a great problem to solve. I think that, well, first and foremost, nurses are the largest segment of the public health workforce, and people don't realize that. And they certainly don't, as you mentioned, they don't, when they think of a nurse, they don't think of a nurse as a public health leader, right? That's not the image that comes to mind. So I think we need to do some work around changing the image that we sell to students about nursing or potential students about nursing. And if we tell the story of our origins
yeah,
better and more accurately, then we can show the roots in public health more clearly. And then I think it's also important for us to acknowledge that we as a profession have been affected by what has happened to health in this country more broadly, which is that has become heavily biomedical,
mm,
right? And while that's an important component of the work that we do, certainly can't diminish that either. But it is only one part of a broader context of the work that we do instead of the defining feature of it. So there's a lot that we need to do in terms of telling that story about how we've become nurses and nursing has become overly biomedicalized. And
yeah,
I think there's a recognition to that. And in recent years, we have done a lot more to advance competencies and put forward competencies around population health,
right.
the social determinants of health, health equity. And so those are positive movements. But what end up happening, and this goes back to your point about limited clinical opportunities, is that the potential role of the nurse as a public health nurse, there's not the financial positions available for that. The reimbursement models to support what could be.
Yeah,
So we're training nurses in what could be settings. Like we have students that go and do work around like parish nursing, where they do work with religious organizations, that we have people that go and do work with migrant farm worker communities. and we have people that work in consulates with
Yeah.
immigrants and things. And so, but those are the only reasons why nurses are in those roles is because it's an educational experience. It's not a nurse who's actually working there that's
Yeah.
supervising them. It's our faculty going, right?
Yeah.
And so those models, those work opportunities don't exist in places that we should be in.
Yeah.
And so that's one of the challenges I think that we need to work on reforming.
You bring up an interesting point here that nurses are not in those settings necessarily. Do you think that's our, I'm going to say that's our fault as a profession because we just haven't done our due diligence in promoting nursing outside of the four walls of the hospital, right?
Yeah, yeah.
Otherwise, if I go into an organization and I have to convince them to create a role for me as a nurse, then nursing hasn't done their job, right? The profession hasn't done its job. Because I've done that before. Like, one of my current roles that I consult is I work with the LA County Department of Military and Veterans Affairs, and my role there is I co-chair the Veteran Suicide Review Team for the county, and I help the department with their uh, uh, veteran suicide prevention work, right? Developing programs and kind of developing strategies with them. But it's a role that if I didn't have a relationship with them and they didn't know what I did, if I went as a nurse, that position would not exist, even though everything I do is founded in nursing, right? And the fact that I come with other skill sets. So I think as a profession, we need to do a better job as to saying this is the scope of nursing, and it's not limited to the four walls of the hospital. But as you mentioned, we're so right now ingrained in that biomedical model that this is the only thing like the public sees. Even though we are in other sectors, but it's not easy for us to get into other sectors. We have to create those opportunities. And if I'm not educating people in where other people, where nurses can be, then those roles like don't necessarily develop. So
Yeah, I think that's right. We at the school we have an initiative that's related to the T32 that you mentioned, that we're trying to claim our work as nurse-led models of care.
mm,
There's a lot of things that we do that are not accounted for, as we know, and there's certainly not a financial model to support to
yeah,
demonstrate the return on investment. So we're trying to use this language of nurse-led models of care, identify exactly what that is, right? What does that mean?
yeah,
And then also try to demonstrate the value of them through our research. And I think we need to do better in learning how to incorporate economic analysis so that we can also use the language, unfortunately, that many people use when they're making determinations around the healthcare delivery system and what is worth investing in.
yeah. You mentioned economic analysis, and I think that's another piece that nursing is not very good at, is showing where we are. Our work has a lot of return on investment, right? So from an economic, let's that economic analysis component, where should that happen? It's not getting taught really anywhere in any program, other than unless you're focused on that specific piece altogether through like research, or if you happen to have like an MSN MBA combo thing happening. But even like people going through their master's programs in nursing aren't really like getting that. Like I go and I sometimes work with colleagues in the education world or on the service side, right?
Mhm.
And leaders in like service line education or even leaders in any education, so many of them have a difficult time talking about that return on investment or creating or being able to communicate the return on investment from a financial economic perspective, and that's
Mhm.
problematic.
Yeah.
So with that said, what are can you share anything that you may have done that from a nursing perspective, anything that you're working on that has that component ingrained in it?
Yeah, I think that we need to do better in terms of our leadership development
Mm,
courses to incorporate that. So that's one place that we can start thinking about it. And then the other place too is when when we talk about the significance of an issue, we are taught as scientists and public health nurses and nurses more broadly, clinicians, that the significance is the impact that it has on people, their families, and the community from a health and social well-being perspective. And we don't often touch on the economic impact that it has to individuals, families, and societies, and from a healthcare system delivery perspective. So I'm not an expert. I knew more about how to do this. I was actually just thinking about this today, because we have right now we're testing a community health worker intervention that is delivered through a community-based organization. And we're getting ready to start recruitment in the next couple of days. So we're about to launch, and I would love to be able to, given that the funding for community health workers has been fickle across the
mm,
United States. There was a ramping up of that during COVID, and we saw the value of it. But unfortunately, some of that has dwindled, right? And I'm concerned with just the future in terms of the financial refinancing of America in terms of our current system and the diminishment of public health, that these opportunities may not be like sustainable because the workforce isn't sustained. So I was starting to think through, who can I connect with that has helped other colleagues of mine with economic analysis. And we have economists that we've worked with that are policy oriented that have helped some of our faculty with that. So
yeah,
for now, my strategy is like connecting with people that have the expertise that can
yeah,
help us figure out the best way we can go about doing that. The other piece is that you know, the American Academy of Nursing has this whole initiative of the Edge Runner initiative, which
right.
recognizes innovative nursing models that to reach that designation, you do need to have some sort of economic analysis incorporated to demonstrate the impact.
Yeah,
And so that are like a great initiative that's helping to promote, I think, nurse leaders to think about this.
yeah. Yeah, I agree with you. And the Edge Runner program is fantastic. I think it's probably a one of one in the
Yeah,
world of nursing, unfortunately.
yeah.
But the academy is policy focused, and it makes sense to have that component as part of what they do. Um, do you think some of this has to do with, and I'm I sometimes get beat up for saying this, but do you think it has something to do with nursing being so focused on the sort of like the compassion, empathy, more of a feeling type of a profession as opposed to really looking at the hard numbers? Do you think that has anything to do with the fact that like we really don't always teach like what is the economic impact of the work that we're doing, and we have to at somehow down the line stumble on it somewhere else or in a different uh, specialty area or something that we have to bring in other experts in. Do you think that has anything to do with it, or um, I don't
Certainly
know.
think it does. We're an altruistic profession.
Yeah,
Many of us go into this because we want a career of service,
right.
and no one comes into nursing because we want to become famous and be glamorous and be on the front of magazines and things, right? So we do it out of real commitment to service that is part of our own identities as people, right?
Yeah.
It's our vocation in life often. So those altruistic inclinations of us nurses, I think, are related to the fact that we don't focus so much on the financial aspects of it. And then the other thing is that I also think that we haven't really claimed the scientific basis of the compassion, the trust that we engender, the caring aspects. There's a science to that. We teach
Right.
our students that science, and but we don't often communicate that to the public, and we don't often think about it in a way that is from a financial lens, but it
Yeah.
clearly has important financial implications. Can you imagine a healthcare system that is not trustworthy, right? Many of our healthcare systems are not trustworthy, but
Yeah.
nurses really help foster the trustworthiness of the healthcare system, and that saves healthcare systems money,
Right.
right? We haven't been able to make that argument. We haven't used financial models to do that.
And that has to do with the power dynamics involved, right? The
Yeah.
insurance companies, the provider model, the medical model that's out
Yeah.
there, all those play a little bit of influence towards all of that, right? Um,
Yeah.
Now, do you think that you mentioned something and it triggered a thought in my brain? Now, if we were thinking about this component of what we do, but would it be a necessary evil, right? I won't call it evil, a necessary skill set, we'll say it that way, for us to be more on covers of magazine and be a little bit more in people's face as to what we do, as opposed to being this altruistic individuals just trying to kind of sneak around in the shadows and do good for everybody, right? But do you think there is a place? One of the reasons I have this podcast is exactly that, because people like yourself, I want people to know about the work that you're doing, right? And the more people know about your work, it elevates your work even further. Than you don't need my podcast to do that, but for like I know for a fact there's like dozens of different universities that feed into my podcast, and my podcast is not monetized, but they feed into it, and I know they're using this content in their classrooms, right? Because I'm trying to elevate the work of nursing. So with that said, don't you think it's necessary that we even teach that? Some places do. Like I know the American Nurse Association California has like a whole media campaign that goes on, and they teach people how to be more media present and, share information. But don't you think it's necessary for us to be more out there? Even though like it doesn't feel comfortable, it's not why we got into the profession, but it's a sort of a necessary thing to get the funding to come our way.
I definitely think so. We do need to be more out there, and it's uncomfortable, like you said. Like I myself sometimes, I publish a paper that I think is important, and I'm always wondering, like, should I be pushing this out? I'm a little embarrassed about it. I don't want people to think that I'm arrogant, like,
Yeah,
you know, you know, but you do want to get it out there,
yeah,
right? And so there's more visibility and it's used more. So
yeah,
we definitely need to get out of our comfort zone related to that. I was just having a meeting yesterday with our marketing department, and I've had the opportunity to be on radio and TV and things in different parts of my academic journey and
yeah.
my role as a nurse. And it's always scary, so scary, but it's it's so helpful in making an impact, right?
It
We
is.
have, it is
Yeah,
part of our communication to society,
right.
and that's part of what we want to, we're excellent at reaching multiple communities, and we need to leverage our communication channels better to do that.
Yeah, I believe so. like, like you mentioned something like, and I'm sure there's people out there that, I'm on social media quite a bit between LinkedIn and Instagram. And I came off of the couple of other ones for personal reasons. Um, but uh, but on the two sites that I'm on there like quite a bit. And specifically just trying to, even if I'm presenting, if I did something, if I whatever, I put myself out there quite a bit. And um, not to necessarily toot my own horn, but if more people see that I'm presenting and that other organizations are bringing me in to present, I want to say hopefully other people will look at it and said maybe we should have him come and present at our venue, not for the purposes of really just having me present, but I have very specific topics I'm trying to promote, which has to do with nursing professional practice, veterans health, a number of other things that I do, but it's important. It's the way I can get my message out there and get some movement on the topics that are on the top of my list, right? So yeah, I mean that I'm sure there's people out there. I'm like, why is that person on social media so much, or why are they getting X, Y, and Z, and they're putting it out there. And it's really that. And, I had to, like I mentioned before, I had a chance to give a talk yesterday, and it was at the Washington State Nurses Association. And I put it out on social media multiple times because not only because I had an opportunity to really create to share some of the things that I wanted to share that's on my agenda of things to talk about, but also the Washington State Nurses Associations are doing so many great things in order to like protect their nurses. They got, they passed legislation around ratios and all kinds of stuff that they're doing that I wish like more state nurses associations would engage in. So very engaged and dynamic group. Very, so it's a sort of like a mutual thing. I get to share what I want. I get to promote their work. It works out really well, and I think we need to get I'm all about, I my life has been all about service, but we have to. I learned a few years ago that if I just publish a paper, and I'm just I just publish a paper, it goes behind a paywall somewhere. Like I'm lucky if like 50 people look at it, right? Uh,
Yeah.
or even use it in any way, right? If two people use it, I'm like, woohoo, good day, right? So if it gets, but if that doesn't happen, I do this podcast with you, and we're going to talk about your work right after I stop talking. But that's going to reach like 60, 70,000 people, like
Yeah.
within a
That's
week,
great.
right?
Yeah. Yeah.
So we have to get more comfortable in with getting the message out in different venues and different avenues. So the impact isn't always going to. I know academia is huge on publications, which is important. That's where we build our science, right? That's where we build our science off of. But that next step of how are we promoting the work, and we stop at like, oh, I did a poster or I did a presentation at a conference. I'm like, fantastic, 400 people heard you. Now what? Right? You've moved on into this other thing. And so we have to get better at promoting our work and what we're doing. So I appreciate you for, getting out of your comfort zone, going on TV and all that good stuff. So that's fantastic. Let's talk about your work. I want you to talk about your work. So your research, you have funded research, and it's around minoritized communities. So talk about that for it.
Yeah, so my research really focuses on the decaying health patterns of Latino immigrant families over time, especially as it relates to behavioral and mental health.
Mm,
So looking at, decays and the emergence of risk around substance use, intimate partner violence in particular, HIV, and mental health conditions. And what our team has found is that through exposure to the United States, becoming racialized, and the process of becoming minoritized, the stress that's associated with being Latino in this country, and acculturating to US society, that is one of the key social drivers of health decay for Latino immigrant families. We see the same, similar phenomenon with other immigrant communities as well. So it's sad to see that although morbidity and mortality is better for immigrant communities when they first get to the United States than for non-immigrant communities, so they have higher life expectancy, less morbidity and mortality overall, the longer they live here in the United States, the more acculturated, and their children have worse health outcomes than their own. So, our team right now, after spending a lot of time studying what is driving these decays and demonstrating that it has an impact not only on behaviors and mental health, but on biological health and physical health outcomes, we have now piloted and are doing a full trial of a community health worker intervention that implements our findings to reduce stress, occultative stress, and to enhance resilience. So, for example, we have found that one of the worst dynamics that happens for Latino immigrant families is the stress associated with having to work all the time to advance economically, to achieve this American dream. But it's at the cost of the family unit and the closeness and unity and support of community that is one of those major drivers of of health and well-being in the community. So our intervention helps families minimize the stress that exists in the acculturation process and provide families with the tools to be able to maintain their resilience as a family, promoting pride in their culture and their heritage, and promoting social networks and family networks and connection to community resources.
No, that's amazing. Um, so
I also have another one other project that is related to this
yeah,
syndemic, and we call this a syndemic. A syndemic is co-occurring epidemics that cluster in historically marginalized populations. So the syndemic that we've been able to identify and develop measurement models and now interventions for is the substance use, violence, mental health, and HIV syndemic. But I'm also currently working with a group of families that have been personally affected by gun violence, have lost children to
uh,
gun violence, and have disabilities related to gun violence, to develop prevention strategies, a roadmap for developing and testing prevention strategies that reach the Latino community in this area.
yeah. Um, That's amazing. Now, I'm drawing parallels. I don't work. I work for an organization, NFQHC in Southern California. So in my head, I'm trying to think of all the things that you're working with that can get copied and pasted into that community and operationalized. So it's really fascinating work. But at the same time, I'm drawing parallels because I work with the veteran community quite a bit, because they have their own. They're not necessarily all part of a minoritized group because veterans are majority of our service members are white, but but they are culturally impacted, right? Because they come from when service members go to into the military, they get enculturated into the military way of life, their personalities, and and this is in their late teens, early 20s when they're having these experiences, and it's imprinted on them for the rest of their life. And they come back into the civilian community with a different culture, right? So some of those support systems that you're talking about is very much a key component of how we keep our veterans mentally healthy, physically healthy, through programs that are addressing some of those exact things. And where we see fallouts is usually around veterans that have left the military and don't have that community to come back to, those community resources available to them.
Mhm.
So really interesting, very interesting work. Well, thank you. Uh,
We framed that because you're right, there is a distinct cultural group, so they share a social identity
mhm.
that that has experienced a lot of trauma,
Right,
right? And it's it there are parallels between that and my other minoritized populations that have also been exposed to their own sets of traumas, right? And
right,
oppressive forces that that really shape the unique experience of people and make them susceptible to multiple health outcomes, negative health outcomes, right?
Yeah. Um, if you were looking at these populations and let's say a community was uh, looking to create interventions, what would be like one or two things that you think is a first step for a community to say we need to address this? Like, how do we do that?
So there's one thing that I'm very excited about recently. I'm interested in doing more research on this. When you mentioned in the introduction that I'm part of the board of directors for a organization that's called El Futuro, the future, and it's a community-based mental health clinic that provides direct mental health care to Spanish-speaking uninsured populations.
No.
And one of the things that they did that really radically changed the approach of the organization was that they invited the neighbors around the clinic to come and their patients. And they invited a well-known artist, a Mexican artist, and the artist asked the neighbors and the clinic the patients to share with him what are some images of hope and belonging that they would like to see on the wall,
Yeah.
and they co-created a mural.
Oh, well.
And the mural then turned into a therapeutic green space that's right outside the clinic. So the clinic is in a strip mall, right? So you can imagine, we know what those look like. And the clinic is right next to an alleyway, and that alleyway used to be filled of bottles, like drinking bottles, a lot of pollution and suspicious activity going on there. And once they invited the patients and the community members to share, like, these are the images that we want to create and see on our walls, and they build a creek there that's like a
Oh, well.
water creek, and it's a green space. And so now people there are sitting on benches talking to one another, and kids are playing in the creek, right? And there's no one that's drinking and throwing away bottles in that alleyway anymore, right? So I'm really interested in being able to leverage more our social and physical spaces so
Yeah.
that they're more fostering health. There's a concept in Europe that's used that's called salutogenesis, which is really thinking about how we can foster healthy health, very similar to like the culture of health campaign of the Robert Wood Johnson
Yeah.
Foundation, right? So we in the United States often think about health as like, avoiding sickness or treating sickness, right? And so this is a different lens. And I really do think that those could be some cost-effective strategies to foster health and well-being and social inclusion that has really profound impacts on health and, particularly mental health, that could be leveraged in ways that we're not asking people, okay, do this and do that, change this and do that. Their environment is such that it is contributing to fostering of health.
I agree. And Dr. Martinez Hollingsworth, she was on the show a few years ago, and I still work with her quite a bit. But she's a muralist. So I think I'll let her know. I'm like, hey, there's a project for you.
I would love to be connected with her. I would
Yeah.
love to be connected with her.
Yeah. She's got a background in murals, and she's done some really incredible work. And I think her PhD work, if I'm not mistaken, had some community-based art interventions also. So yeah, whenever you want to do that study, yeah, definitely connect with her. Uh,
Definitely, and that goes back to, you were sharing about how do we get our results out there,
yeah,
in ways that they're received. Being on the board for El Futuro has helped me get my research out there in a way that's more immediate. So they
yeah,
use we have found in our work that if you have a strong sense of cultural and ethnic pride, and also if you have opportunities to engage in activities that both connect you to people from your community and then also foster um, the maintenance of your culture and the
Yeah.
pride around that, that helps buffer against the impact that
Mm.
stress has on negative health,
Yeah.
right? So they've been able to use our research findings to support, you know, the ideas that they're implementing, but also it's a way of just, you know, disseminating your work through art, right? That here's a mural that fosters those kinds of mechanisms of cultural pride and social inclusion. But we've also done some um, work with like poetry and inviting young people to share poetry and then also spoken word
Yeah.
to talk about the topics that we have found to be most impactful. And obviously, those resonate with the community a lot more than our figures and our stats do.
Yeah. That's amazing. Actually, the podcast right now, that's as we're recording this, the podcast is just the third podcast in this season with Dr. Jamaluddin. She does spoken word poetry and very powerful, very powerful. Like it brought tears to my eyes when she was talking because it was like it was amazing. But yeah, but how do we, again, how do we get out of the, what we've been, I want to say what the structure that we've been handed and kind of think
Yeah.
outside of that, right? And create those opportunities again with green spaces and combining green spaces and art it almost feels like, oh, it's a no-brainer. But when we think about some of the minoritized communities and the areas that they live in, it's like sort of a concrete jungle of buildings and stores, and there's so much limitation as far as green spaces being available, right?
Mhm.
And it's unfortunate, but it's capitalism and real estate and just green space. Like the fact that once in a while I see a green space go up somewhere, I'm like, that's amazing. We need more of that. We need so much more of that. But I agree. All right. Yeah, that's really great work. Um, Anything else that you want to share? I know you're doing a lot of great work.
Well, I'm really like you in the sense of mentoring is important to me. And I do a lot of mentoring of early career scientists and been just really worried about them now in terms of the climate that we're in, where science and academic freedom
Yeah,
is being challenged, and they're doing really great work around social determinants of health and health equity, and are finding limitations in doing that work currently, in terms of getting federal funding and those kinds of things. So I'm really concerned about
yeah,
that, and thinking through strategies that we can use as a community of nurses and scholars to
yeah.
be able to support them.
You brought up a great question, and not to make nursing political, but nursing is political, right?
Definitely.
Um, you just brought up a really great point, and I know I've talked to a couple of colleagues around this, and some of your own work, which is around minoritized populations, with the current administration, might get affected, right? Fingers crossed it doesn't, but it could get affected. Some of the work that I do is federally funded with the same because I work with some minoritized populations. So, having said that, and you being in an academic setting, what are some best practices, or if you have seen any best practices of what academia is doing to continue to support the work of new nurse scientists?
So I just wrote a piece that was published in JAMA that provides a few strategies that I think are important. The first is that I think it's important for us to make sure that when we're supporting our early career folks that they had a clear mission and vision, and doing some like career cartography of, who they are and who they want, how they want their research to have an impact in the long term.
Right.
Um, to be able to explore the multiple ways you can get there, right? There's some traditional ways to get there, and then there's other non-traditional ways, and you can use a combination of different strategies to get there, if that there's roads that you have to avoid for particular kinds of funding, but that doesn't mean for everything, right? And so I think that's doing some career cartography and supporting early career folks to make sure that they are doing the work that they were born to do, were called to do, and are driven by. That's really important. The other thing I think is to use an ethical framework to be able to make decisions around, pivoting is a word that a lot of people don't like these days. I would say more of a like a strategic alignment of opportunities and intended outcomes using an ethical principle, an ethical framework, right?
Yeah.
So for early career scientists that are in this space of health equity, right? They define themselves as health equity scholars. So by us kind of, pretending that their identity isn't tied to that and not supporting them to pursue their ultimate goals, it's gonna cause a lot of moral distress,
Yep.
right? But we could support them in terms of seeing opportunities and way to strategically align with those opportunities in a way that also doesn't cause like a moral injury of what they feel is important, like it for people not to feel like they're selling out on their
Right.
cause, right? There's ways to do that. I think that we need to be really thoughtful about. And then the last strategy is, I think, to be able to get work done in ways that we haven't done it before.
Mm.
So for example, if there's, we could reframe a research study from a program evaluation or quality improvement perspective,
Yeah.
right? And by doing that, we might be able to tap into other kinds of sources of funding for that kind of research that's embedded in those approaches. And then thinking about, the traditional ways of thinking of going for NIH funding or federal funding from other things is you could piece together different funding streams to get the big picture accomplished, and helping early career scholars be able to identify those opportunities and put those together.
Yeah, I agree. And I think that that's another piece that nursing is sort of shoots itself in the foot type of a thing is I've heard nurse scientists, experienced nurse scientists say, oh, if it wasn't NIH funding or if it wasn't NINR funding, then it's not really it doesn't meet the rigor of nursing science or science in particular. And there's so many people doing some incredible work without NIH or NINR or any other big names out there funding, but the work is transformational and it's with huge impact. And I think we've sort of sold everybody on this NIH, NINR thing, which is fantastic. I'm happy to have it, right? When the opportunity is there, but it's not the only way to do business. And I think some of the universities are selling like that's the only thing you can do. And I think it's um, it's uh, it's discouraging for a lot of people when that's what they hear. Right. But I know some incredible individuals doing some incredible work, impactful work, that never had NI, myself included, never had NIH or NINR funding, right? But
Yeah,
you find funding elsewhere. That's what people with organizations that are willing to support your vision and your work. It doesn't affect the rigor of the work at all, I don't think. But
I agree with
I'll take money where I can get it. I mean, if somebody wants to do a GoFundMe page, I'm like, do it. Let's get this done,
do
right? So
it. I
it's all
agree
good.
with you 100%, and I think that universities are starting to get it now.
Yeah.
because of the
Well, they need
situation.
to. If they're going to keep their doors open, they better figure it out that NIH and NINR and stuff like that are not the only sources of funding. So if that's their benchmark, they need to close the door right now.
Mm-hmm.
Yep.
Yeah.
So I appreciate. Well, thank you. I appreciate you. I want to be cognizant of your time. So thank you for being here. Anything else before we sign off?
No, thank you, Ali. It was great chatting with you, and I respect you and your work so much. I'm very grateful to have this opportunity.
I appreciate it. Hopefully we'll see each other in person soon.
Definitely.
Thank you. We have been listening to Dr. Rosa Gonzalez-Guarda. Uh, again, so happy that you were able to make time for us to join us. For all my guests, looking forward to bringing you more incredible colleagues from around the world. So have a great one, and we'll talk soon.
Thanks.
Thanks for joining me on the RN Mentor Podcast, a production of RN Mentor Consulting. Please don't forget to follow and check out rnmentor.org for additional content, speakers, podcast notes, and more. Until next time, fair winds and following seas.